So I'm going to flip through these cards and you're going to see a single card and try to just remember that one, okay? Not the one back here, but you're going to see just one like that, okay? Like that. Sorry, that was really fast, but look. Do you have one in your mind? All right, think of it, okay? I know this card is blank right now, but think of your card and... Hey, what's up everyone, and welcome back to another video. So this video today is going to be my advice on how to best prepare for your interviews for residency if you're at the end of medical school, but these tips can also be applicable to you if you're applying to medical school and preparing for interviews there. I understand that now a lot of medical schools, especially in Canada, are moving towards a multiple mini interview format, which is a bit tougher to prepare and which some of the advice here is not really applicable. But nonetheless, I think this can be useful to you in just preparing yourself and being less stressed for these interviews. So basically in this video, I'm going to be going over a little bit the interview process in Canada for residency. And then we're going to be going into a list of questions that I think are the most common questions that you should be really comfortable answering and have a good answer that you're really happy with. And lastly, I'm going to talk about a little exercise you can do to kind of classify and recall all your clerkship highlights or experiences so that they fit under a certain framework and you can kind of pull them out at any time to talk about those experiences during interviews. So for those of you who are not in medicine and not in Canada, the way interviews work in Canada, for residency anyways, is quite special because of the fact that there's only 17 medical schools in Canada. And so when you're applying to something very competitive as a specialty, you are going to apply to all of these schools usually if you don't restrict yourself geographically. And a lot of people are going to have a dozen interviews or interview at every school. So usually these programs are going to try to coordinate their interviews so that one applicant who is applying to, for example, a certain program like general surgery is going to travel from West Coast to East Coast, kind of stopping at every city, at every university they're applying to, and to make everything really condensed, one interview a day, so as to not waste too much time and make traveling a bit easier for everyone. So this is referred to as the CARMS interview tour, CARMS being the organization that helps process the applications and the match and by linking programs and applicants. So usually around January, all of the med students in Canada are going to be interviewing at various places, and for a one applicant, you would spend 1 or 2 days in every city and be flying across different cities or driving around depending on the distance. So usually the night before an interview or sometimes after, there's going to be a social night where the program welcomes all the applicants to a restaurant, a bar, or a certain just chill environment so that you can meet some of the staff and meet some of the residents. And usually it's very low stress. It's kind of a chill time to just kind of get to know people and ask some questions informally. So this night is not officially part of the interview process, and if you don't go, no one will necessarily know. But you can definitely get, I think, red flagged if you do something crazy, if you get drunk, if you're disrespectful to people, or they just don't like you during that night, then that can definitely hurt you if you stand out in a bad way. But usually I would say it's quite chill, and that's the purpose isn't to screen people or anything. So the interview format can be variable, but I found that across the board, they still stick with the classic interviews, especially for these smaller programs where they really kind of want to get to know you and see how you are one-on-one almost. So usually for one interview session, you're going to have 2 different interviews. The duration can be anywhere from 15 to 30 minutes each. So for the format of these interviews, for each interview, you're going to have 2 interviewers, usually one staff physician paired with a senior resident. And so that can be variable too. I've interviewed at places where it was a single staff surgeon, and other places where a single station was 2 staff surgeons and a resident. So it really depends on how they want to make it happen. So basically, my general advice for these interviews is that people are really nice. They're not trying to trip you up. They're not trying to trigger you or push you too hard on your questions. They really do want to get to know you. Oftentimes they have your file in front of them and they're going to ask questions based on that. But a lot of times too, they're just gonna ask these questions that they have from a list, and they just talk to you about it. Sometimes it's a conversation and there's a bit of back and forth, and sometimes they're just gonna answer the question in 2 minutes, and then you move on to the next one, and they basically score you based on that. And so I really didn't find that they were trying to make you stressed out, and when they say that they really want to get to know you, that it was generally true. And so the only advice that I have that is really applicable to everyone is to be your best self. And you really just want at the end of that interview to be happy with the way you presented yourself. And to do that, I would encourage you to practice with friends, do it live, practice over and over these questions that we're gonna go through in just a second. Basically memorize all of these answers and spit them out consistently, but also put in some acting and some enthusiasm when you answer these so that they look natural. But I think that practice helps a lot. And I remember having a few practice sessions and really becoming comfortable with those answers. And at the interview, that showed a lot. And also, don't worry about being the best interviewer in the world or being the best person that they've ever met in the past decade. I've heard that they usually have a shortlist based on your application already. Interviews really serve to screen people to see if someone's a red flag and if they should really bump them down the list. But usually people aren't going to be jumping higher up in that list based on an interview only, which I'm sure is possible, but generally that's not the case from what I've heard. So really one of my big tips too is just don't be weird. Don't try to be special. If you are special, be yourself, but don't try. So with all that being said, let's go into a list of questions that our interviewers usually ask, which I think are the most common ones that I was asked on interviews, but also the ones that I think you should have a really, really well prepared answer for. And so here it is. This is the list that I think are the most common questions, or the questions that you should have a really strong answer for, along with things that I was actually asked. But this is generally the list that I used to prepare myself last year. To start off, definitely, I don't think I need to tell you that you need to have good answers for this, or answers that you are satisfied with, and also answers that aren't too long, especially questions like why this specialty or tell us about yourself. That can easily go on for hours and hours if you like talking about yourself, but you want it to be succinct, interesting, and also gauge how much they're interested in the conversation. But tell us about yourself, why the specialty, why should we pick you in particular, and why do you want to train in our program, which you should kind of look up the strengths of the program or what they say their strengths are. As well, you can kind of say that you're close to family, or that you want to train in this city particularly because you like the city, and you're allowed to be honest about the location of the program too. Strengths and weaknesses are pretty standard in or outside of medicine. Most interviews you should have honest answers for these, and of course you don't want to humble brag or make a pseudo weakness saying that, oh, sometimes I work too hard or something like that, or I don't delegate or something. That just seems like you're being dishonest. I would just be careful about that. But again, it's really what you want. What do you do outside of medicine? Actually, that's a common question that you should be prepared for, because they ask it a lot. They want to know if you're kind of one of those people who are obsessive about medicine and that's all you do, or you do things outside. And that also shows a bit of time management, because everyone knows that medicine is really busy and that you have a lot of hours dedicated to it, but they want to know if you're able to do other things that you enjoy in life, or you kind of just slave away at the work you have to do, work because you have to and do all these hours. So, and of course you can be super typical and say you go hiking or you like going for brunch or whatever, but if you have something special, make sure to bring it out at this time. A classic one that's sometimes difficult to answer is the biggest accomplishment, because you kind of have to brag, and also sometimes people just don't have these huge accomplishments, which I don't think I really had anything that huge, but I did talk about something that I was very proud of. But I know that for some people it's really, but for sure some people have these really, really crazy accomplishments that I feel bad comparing myself to, but try to pick out something that you're really proud of and talk about it. Then the rest is pretty standard. You can use this Word document and kind of fill it out and have these bullet points for you to bring with you kind of the night before the interview or the morning before the interview. You just go through this list and then you have everything in your mind ready to go. That's what I did anyways. And then have this whole section about tell us a time when you, and kind of these are very common. Difficult decisions, mistake, ethical or stressful situations, times where you had to act fast, there's always like authority figure things and had to resolve a conflict, which personally I think are very kind of lame to talk about, but you just have to have something prepared for that. You never want to say, oh, I never really had a conflict, because that just sounds like you're avoiding things, right? And a bunch of these obviously can relate to your clinical experience as a med student, because obviously in the past 2 years, you probably most of your time was spent in the hospital or gaining clinical experience. So most of these can be, but if you have significant experience outside of medicine or in other leadership roles or anything like that, you can definitely talk about that, and it doesn't need to be all about medicine. And here I have kind of a little section, which is a little bonus, the CanMeds roles, which I'm sure if you're in medical school in Canada, you should kind of know a bit about them, or know that the framework is there to structure the different objectives of medical school. And basically you should know them and then try to think of why of an experience with each. We'll go into that in a little bit. The last one I want to touch on is teach us something. That's something that you hear a lot of people talk about when they talk about the requirements interviews. They're like, oh, I just showed up and they were like, teach me something. And people freak out because they don't necessarily have anything particular that they can teach like right at this time with the tools they have right now. But if there's any hobby that you have, or anything that they would know, or any language that you can teach them a few words, or teach them about a subject you're really passionate about. That's always something, but try to have something in your back pocket for this question. Moving on to this little exercise here, which I found very valuable, but I can understand why you wouldn't do it. Seems like a lot. So basically here's how I would do it. Sit down sometime, open a Word document, and try to just go through every single rotation you had in medical school. And for each rotation, try to pick out what stood out in your mind. Like, what do you remember from that rotation? It can be good things, bad things. It can be medical things like pearls that you still use at this time, or really bad examples of patient interactions. Or moments where you had to do something yourself that you weren't comfortable with. Really anything that stands out, and try to think why it stood out. And so does that shape what kind of student you are now, or what kind of physician you're going to be? Did it really change the way you're looking at things? And I thought it was a really cool exercise to just see what stood out in my mind for these rotations that you've had. And you've had a ton of experience as a med student. And so basically I use this highlighter system on Word there, where I just chose a different color highlighter for each of these roles, and I went through that list of experiences and I highlighted the experiences according to the category they fall under. And this is a pretty good framework, to be honest, when you think about it like this. When you think about a good physician, you should think about all of these aspects. I think it's tough to take away one of these aspects and say that you're a really well-rounded doctor. So you go through all this, and a lot of these are going to be like professional or collaborator, because as a med student, that are kind of easiest to accomplish and that stand out. But go through all of that, and then you can kind of see like, what are your strengths, what are your weaknesses, where is there a role that you like literally never did, or nothing stood out. And I just found it was a good way to then be able to plug those here or plug those up here when you have to tell us about a time when you had to do something, because you can use those buzzwords of CanMeds and you have it fresh in your mind, and it really makes a lot of sense as to why it is standing out to you. So I encourage people to do this because it really summarizes your clerkship experience, and you're able to have a list of things that you can just pull out at any time if you have this paper ready before going into the interview, for example. All right, everyone, I want to thank you guys for watching. I really hope that this is helpful, especially for those who have an interview coming up soon. I wish you all best of luck in your preparation and on your interview day. And again, this might seem excessive to a lot of people. A lot of people say they wing the interviews. I just think in general that you can't really over prepare for interviews, because you really want to show your best self, and the more you practice, the better you're going to get, and the more satisfied with your answers you're going to be when you come out of those interviews. So thank you all for watching, and I'll see you guys in the next video.